Good morning, everyone, and welcome to our International Student Insurance webinar as we discuss how to navigate the U.S. healthcare system during COVID-19. Before we get started, I'll go ahead and introduce myself. My name is Sally McLeod, and I have been working with ISI for over 5 years, assisting colleges and universities, as well as their students, understand and find a health insurance plan to meet all of their needs. I'm here today to help you gain a deeper understanding of how the US healthcare system works and things to consider when going to seek treatment during a pandemic. So, just who is ISI? International Student Insurance is a specialized insurance agency as we sell health and travel insurance to students from all over the world. Founded in 1998 and online since 2001, we are a trusted industry leader providing insurance to students studying outside of their home countries. We are global with our main office located in Neptune Beach, Florida, and additional offices located in Germany, China, and Mexico. We only work with international populations and cater specifically to international students and scholars. We're also very proud to mention that we have a very dedicated customer service team, and that really speaks for itself through our 5-star Trustpilot rating with over 120 reviews from students like you. Here's an overview of what we're going to be discussing today. First, I will give a breakdown of the US healthcare system. The US healthcare system is really unlike any other. And while you're able to get some of the best medical care in the world, it can also be very expensive. I will go deeper into this and discuss the importance of insurance requirements for your visa and from your school. I'll then talk about how to choose an insurance plan based on this information and discuss how you can use your plan and where to go to seek treatment. We'll then get into some specifics on what to do if you're experiencing symptoms of COVID-19 and where to get the care that you need. We'll then discuss plan options that we have available and answer any questions that you may have. So let's start by talking about the US healthcare system and what really makes it so unique. Unlike many countries with socialized healthcare, the US healthcare system is not a universally accessible system. It's your responsibility to make sure that you have a health insurance plan in place to cover any costs when seeking treatment. I can't emphasize enough about how expensive it is to seek medical treatment when it comes to the US healthcare system and in the United States. As you can see, we have a few things listed here. A fractured humerus can average on up to $50,000, while a fractured clavicle can be close to $20,000. These numbers really speak for themselves and emphasize the importance of making sure that you're covered by an insurance plan so you can avoid having to pay these crazy costs. So let's take a look at your insurance requirements as it pertains to your visa. While many students come on an F or M visa, it's surprising to see that you actually don't have any specific insurance requirements from the United States government. This leaves you or your school responsible for having some sort of insurance policy in place for you, and you'll want to double check with your school before making any decisions on purchasing a plan. As you can see, it is a little bit different if you're on a J visa. There are specific requirements in place in order for you to obtain your visa. Your school or organization that you're affiliated with can instill additional insurance requirements just to make sure that you're properly covered. Now, there are a couple of ways that schools have insurance available to you. Some schools have a group health insurance plan in place in which all students are required to enroll in order to register for classes. This can be with or without what's called a waiver. A waiver is a list of minimum requirements that you need to meet in order to opt out of enrolling in your school's plan. Some schools may not even allow for a waiver option and just require that all students enroll in their plan in order to register for classes, regardless of any other factors. Schools may also have each student enroll and pay for their plan individually, and That way, the student would provide proof that they are covered in order to register for classes. While other schools simply provide options and leave it up to their students to purchase a plan that works best for them. We always recommend that you contact your school directly to make sure that you fully understand what requirements you need to meet. However, we have created a database with many school requirements for your reference based on information that we've received from colleges and universities as well as their students. You can visit our website and simply click on the school requirements section at the top right-hand side on our main page. If your school is allowing you to choose an insurance plan, we recommend that you take the following considerations into account when shopping around online. Make sure that your policy maximum, or the most that your insurance plan is going to cover, is at least $200,000 or greater. Be aware of what a policy maximum is versus the maximum benefit per injury or illness. Make sure that the maximum benefit per injury or illness is also at least this much. And be aware of what your out-of-pocket expenses look like. This is what you are going to be required to pay for on your own. So terms to be familiar with would be deductible, copay, and coinsurance, as these are all things that you are going to be responsible for paying. Take a look at your plan benefits and familiarize yourself with them. Are you looking to cover anything specific? Some common benefits are listed here and include the following. So we can see mental health would be something to be on the lookout for, organized sports coverage, pre-existing conditions, maternity, repatriation of remains, and emergency medical evacuation, as well as being aware of any sort of sublimits or caps on specific benefits, not going all the way up to the policy maximum. You'll want to see what kind of payment options are available to you. Does your plan allow you to pay monthly, or do you need to pay in full for the entire duration? And the period of coverage. Does your plan cover you for the entire period that you're going to be in the United States or be needing health insurance for? You'll also want to familiarize yourself with the plan network that your plan is a part of. So that would be, what network is your plan using in order to allow for direct billing to the insurance company when you go to seek treatment? Just as important as understanding what your plan benefits are, it's equally important to understand what your plan does not cover, also known as your plan's exclusions. So, some common exclusions are listed here, and we can see, similar to the benefits to be looking out for: pre-existing conditions, routine physicals or vaccinations and immunizations. You'll want to take care of this at home if you can to avoid any additional costs while you're here in the US. Again, routine vision or eye care, as well as dental and drug or alcohol related injuries, and anything that's not medically necessary, extreme hazardous or organized sports, and maternity, childcare, or other related expenses. Now, regardless of what insurance plan that you have, here's a list of common places that you'll want to familiarize yourself with when going to seek treatment. The Student Health Center should be the number one place that you go if you are able. Many college campuses have this available to their students. Costs are usually at a very reduced rate, or they can also be free. So seek this out whenever you can so that you can save on costs. There's also the Urgent Care Center or walk-in clinic. This is great if you're looking to have something addressed immediately. You can usually walk in without an appointment, and there are a multitude of tests that can be run there, as well as treatment that can be sought. You can also go to a doctor's office or your general practitioner. This is something to be you would need an appointment in order to go and seek treatment at your doctor's office. This would be something if you are looking for ongoing treatment or have an array of different issues that you would like to see one specific doctor for. And then we also have the hospital emergency room, or what's known as the ER. You will see that many health insurance plans have a higher deductible if you're going to seek treatment in the ER, because it is very expensive and it should really be reserved for emergencies only. Then the last one we have here is telemedicine. This has become more popular as we're all staying at home and not going out as much. This is an easy way to connect with a doctor, either on the phone or virtually online, and you can seek treatment for symptoms that you're experiencing, as well as ongoing care or getting any sort of prescriptions refilled. So now that you have an understanding of things to look out for on an insurance plan and how and where to seek treatment, let's talk specifically about seeking treatment during a pandemic and what to do if you feel like you have been exposed to COVID-19. If you begin to feel sick or are experiencing symptoms related to COVID-19, you should stay at home, of course, and self-isolate, avoid contact with others, and call your healthcare provider. You can call a local urgent care center or your general practitioner if you happen to have one. They will give you detailed instructions on what to do and may have you answer a series of questions over the phone to assess whether or not you should be tested and how to go about getting tested. Telemedicine, again, is also a great option for this and is great for any sort of medical advice if you feel like you're experiencing symptoms and what to do from there. Now, going back to your insurance coverage, it's of course very important that you confirm that you're covered for COVID-19 and what exactly that coverage looks like. So here at ISI, all of our plans will offer coverage for COVID-19 if you're experiencing symptoms. If you're looking for a plan that's going to offer coverage for this, in addition to new injuries and illnesses, our Student Secure plan is a great option. This plan comes in 4 different levels, and all levels will meet the Department of State requirements for the J visa and allows you to choose the level of coverage that works best for you. There are some additional benefits here about the Student Secure plan. So you can have coverage starting as early as the same day. You can apply easily right online. It just takes a few minutes or over the phone and have coverage starting right away. Coverage is available in all 50 states and anywhere else outside of your home country, as long as your valid student status is maintained. You can buy coverage from as little as 15 days up to 1 year, and then you can renew it for up to 4 years in total. You also have different payment options, so you can pay either in monthly or in full. You can have it deducted automatically every month from your credit or debit card, or you can pay for the entire duration that you need coverage for right up front with your credit or debit card. This also offers direct payment through the United Healthcare Network. So this plan uses the United Healthcare Network as the provider network. It's one of the largest networks across the United States. You can easily go online and find urgent care centers or other providers within the area that accept United Healthcare. That way you can avoid having to pay up front, and the provider can bill directly to the insurance company. It also has the option to include organized college sports on 3 out of the 4 levels. So if you are playing college sports, you can add this on for an additional cost. And as mentioned before, this does meet all levels meet the Department of State requirements for the J visa. And this also works well for many schools and will meet many school requirements. The Student Secure plan also gives you access to what's called your Student Zone. This is essentially a portal in which you can log in and find a doctor or hospital within the vicinity. You can track your claims online to see if anything additional is needed or how they're being processed, what all is being covered. It also gives you a seeking treatment guide, so you can go about You can read about how to go about seeking treatment and the best place to go, as well as frequently asked questions from students like you. There are also an array of other features available on there, so you can update your personal information, your address. You can also extend or renew your coverage right online. Okay, and so that wraps up everything. I hope that this has given you a better understanding of the US healthcare system, in addition to selecting a health insurance plan and what to do if you have been exposed to COVID 19. If you have any questions after this webinar or need help finding an insurance plan, our customer service team is available to assist you, and they can assist in multiple languages and will provide unwavering support. We hope that everyone stays safe, and we're going to go ahead and open up the floor for any questions. Okay, does anyone have any questions? Okay, so we do have one question here, and it's what if my visa gets denied? So with our plans, specifically the student secure plan, you can cancel coverage anytime before the start date for a full refund. So as long as your coverage hasn't started on the student secure plan, if your visa gets denied, that's perfectly fine. You can just simply fill out a form and request cancellation before the start date and get a full refund. See if there's any other questions that are coming in. Okay, here's another one. So, do your plans cover testing? Yes. So, our plans here at ISI do offer coverage for COVID 19, the same as any other injury or illness. However, you do need to be experiencing symptoms, as our plans don't cover routine care. But yes, you can. Our plans do offer coverage for COVID 19 if you're experiencing symptoms of COVID. All right. Well, I guess that wraps up everything. Thank you so much again. If you have any questions after this webinar and would like to get them answered, feel free to give us a call and reach out to our customer service team, send us an email, check out our website. Thanks so much, and we look forward to seeing you next time. Stay safe.